Thumb pressure should be done with the fleshy part of the thumb. Thumb pressure depth should vary throughout the massage and will be determined by how much sensitivity is exhibited by the dog in each spot that you apply it. Use very light pressure on the hypersensitive spots. Hypersensitive spots could be anywhere on the body, and the dog will warn you by looking at you, moving away from pressure when you get to the spot, and muscle twitching or coat twitching can also occur. Lighten up if you see any of these signs. Sometimes your pressure will just be enough to make contact with the hypersensitive point. There could be damaged tissue here, nerve entrapment, or nerve irritation. In traditional Chinese medicine, this point could be a point that is over-energized, or energy could be leaking out of this point. In either case, we would use very light pressure to desensitize the point or plug up the leakage of energy from this spot. The next level of pressure would be just enough to trap the muscle against the bones. Remember that the muscle is soft and bone is hard. It should be easy for you to feel the difference. Gradually increase the pressure over a 10-second time period. Get the feeling of sinking in instead of pushing in. The dog will allow you to sink deeper into the tissue if you ask for change versus demand change. Be patient and watch for signs of oversensitivity. Once you feel like you have found the bottom of the pressure and no further depth is attainable, slowly release the pressure and move your thumb a half thumb's width to the next point on the muscle. The overlap here will make sure you have flushed out the residues of metabolic waste in the periphery of the tissue that you have just worked. Thumb pressure traps the muscle against the bone, thereby effectively retarding blood flow to the tissue and creating a back pressure to localize blood flow. It creates space between the muscle cells by spreading them out under pressure. After slowly releasing the pressure, the dammed up blood rushes back into the area, washing away any cellular metabolic waste products, inflammatory agents that might be there due to tissue injury, and any dead cell parts that could be in the area due to injury. If you release the pressure too quickly, the dog will not be able to concentrate on the pleasant feelings of the warmth of the blood slowly moving back into this area, and it will be jarring to the system. Thumb pressure will also reduce trigger point hypersensitivity. Trigger points are localized, hypersensitive points that can radiate or refer pain to a distant area of the body. You could be applying pressure over a trigger point in the leg, and it could radiate pain to the neck. Trigger points can cause splinting effects in the dog that decrease the ability of the dog to attain muscle action and reduce range of motion of a joint. Splinting or guarding against movement to prevent pain throws off the whole natural alignment of the dog and has cascading negative effects as the brain attempts to realign the body to keep balanced movement. When you feel that you are over a painful spot and the dog is obviously paying close attention to what you are doing, stay on the lighter ranges of thumb pressure so that the dog does not move away because of too much pain. These areas need extra attention, and you could remember these spots for later treatment. You might feel the muscle twitching while you are applying pressure to these areas. Be patient. Keep the pressure steady until the twitching stops, or lighten up on the pressure a little to allow the twitching to stop. Use your intuition here. Experiment with both approaches. Each dog is an individual and will respond to different approaches. If you find that the dog will not tolerate any pressure around hypersensitive spots, try moving to the periphery of this area to a place where the dog starts to relax. Work along the outermost border of these points. By doing this, you will improve the blood circulation gradually to the affected point and desensitize the nerve endings around the area. You can always come back to these points in later sessions. When you return to these points in later sessions, do not rush up on them and trigger a guarded response. Work the periphery first and gradually approach the epicenter. You should see improvements each time you follow this approach. Sometimes when doing thumb pressure, you will feel the tissue is hotter in this area than in other areas that you have worked. This could be a sign of localized inflammation. Ice therapy in this area may be helpful to reduce the pain and reduce inflammation. Sometimes you will feel that the spot is colder than the surrounding area. This could be a sign of lack of blood flow into the local tissue. Stimulating blood flow into this area with heat applications or applying gentle thumb friction in this area will stimulate blood flow to the area. You may also feel hollows or holes in the tissue as you move along. This could be due to tissue damage or could be a place where the muscles are starting to overlap. You may also feel that the tissue you are over is swollen or harder than the other tissues you have been working on. This could be indurated tissue or you may be over a bone. If the hardened spot slowly changes, then this is tissue. If it doesn't change, it is probably bone. It would be helpful to do spot treatments on trigger points every few days for a few minutes on an otherwise healthy dog. If the dog is older or weak, leave a week's time in between treatment so that they have time to recover from any irritation to the tissue that might occur due to the pressure. Make sure that you don't overwork the tissue and cause too much irritation. Allow the dog to rest in between sessions. The dog may appear sluggish the next day after a session, and this is probably due to the release of lactic acid and other metabolic waste into the general circulatory system. This should subside in a day or two, and you should see a marked improvement in the dog's energy levels and ability to move the joints freely. If for some reason the animal seems to remain at a low energy level or the original imbalance seems to be worse, you might have overworked the tissue or the skeletal structure might be attempting to realign and be stuck. Have your veterinarian check the dog out and see if it might need a chiropractic or osteopathic adjustment. Also make sure that the dog drinks plenty of water in between sessions to help flush out the toxic residues that will be released during the massage session.